Today is Wednesday, July 8th, 2020. My name is Jackie Pelota, and I'm here interviewing Natalia Useche for the Voces Oral History Center at the University of Texas at Austin. Please know that this interview will be placed in the Nettie Lee Benson Latin American Collection at the University of Texas at Austin. If there's anything you don't want to answer or talk about, I'll honor your wishes. Although also, if there is something you want to talk about, please bring it up and we'll talk about it. Because we're not conducting this interview in person, I need to record you consenting. So I'll ask a series of 5 questions. Please say, yes, I agree, or no, I do not agree after each one. There are 2 questions we need to make sure you agree to before we go on with the interview.
Okay.
Voces wishes to archive your interview along with any other photographs and other documentation at the Benson Library at UT Austin. We will retain copyright of the interview and any other materials you donate to Voces. Do you give Voces consent to archive your interview and any materials you have at the Benson Library?
Yes, I agree.
Do you grant Voces copyright over the interview and any material you provide?
Yes, I agree.
Do you agree to allow us to post this interview on the internet where it may be viewed by people around the world?
Yes, I agree.
We have many questions in the pre-interview form that we already filled out. We use that information from the pre-interview form to help in research. The entire form is kept in a secure Voces server. Before we send it to the Benson, we would strip any contact information for yourself or family members. So that won't be part of your public file. Your public file will only be accessible at the Benson Library. Do you wish for us to share the rest of your interview in your public file available to researchers at the Benson?
Sure, yes, I agree.
On occasion, Voces receives requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone number or your email with journalists?
Yes, I agree.
Thank you so much. I know that was long, so thank you for bearing with us. It's definitely different when we're doing it via Zoom. So we can just start by having you share a little bit about yourself, where you're at, your family, background, profession.
Perfect. So my name is Natalia. I was originally born in Caracas, Venezuela, and moved to Miami when I was around 5 years of age. I grew up most of my life in Miami, and then I left to college in North Carolina. When I was in college, I wanted to pursue something in the healthcare field, but I wasn't necessarily sure what it was. I was pre-med at the time, and basically, I had gone on medical missions starting in high school, and I loved the caring aspect and the being a support for the person seeking care. And I just feel like I didn't get that with medicine, with the way that things are now in medicine. So I shadowed a bunch of healthcare workers, and I shadowed a nurse, and she was excellent and amazing. And I was like, this is what I want to do. So I moved back to Miami, did my prerequisites, and went to nursing school down here in Miami. And I worked here at a hospital locally, and I focused there on the progressive care unit, as well as transitioning to critical care. And then I travel nursed for approximately 10 months, where I was in Boston for most of the time, and I was there during the pandemic.
Well, thank you for sharing about that. So since you were mainly in Boston during the pandemic, I guess, how was that? How was that experience?
It was incredibly hard. I think initially, when COVID first started, all the nurses, even nurses that had 15 years, 20 years experience, who usually have no anxiety related to work, come in and they're just, battle axe, badass nurses. When you go into work as like a relatively new nurse, you're anxious sometimes because you are dealing with people's lives. And when COVID happened, we had some of these nurses that had 15, 20, 30 years experience actually saying, I'm anxious for the first time. I'm not able to sleep. We didn't know what was coming. And like hearing all the news from China, Italy, it was just like an unprecedented time. And we didn't know what was going to happen. And initially, when everything started, they canceled any elective surgeries. And during that time, like the hospital was empty, 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 empty. And it was eerie. Like even our whole critical care unit, like we had open beds and we were all just waiting, like what's going to happen? Like, is this the calm before the storm? And we were just all there sitting like anxiously waiting for like what was going to happen. And after like 2 or 3 weeks, maybe in April was when it started picking up, we got flooded with patients. And it was the first month and a half was terrible because we were dealing with a disease that no one knew anything about. We were trying to figure out what the best way to treat it was, different ventilator settings, different medications to see if maybe this one works, maybe this one doesn't. So for like the first month and a half, I feel like we had a lot of deaths. Not only because it was something so novel, but because these patients were like so incredibly ill. And it was really hard. I mean, my first patient that passed away was 29 years old, and that's how old I am. So like it shook me because it made me realize like no one is safe from this virus, and we can all live our lives thinking, it's not going to happen to me. Everything's going to be fine. I'm healthy. I have no pre-existing conditions. But the truth is, and being in the ICU, you learn this, like there's no guarantee to life. You have to wake up every day thankful and grateful that you're alive because tomorrow isn't promised. And it was really hard. I mean, so many nurses that I know, I mean, me included, we had to start going to therapy, seeking psychiatric care because most of us were battling with severe anxiety, and then depression because we didn't, at least for me, like no one really understood what was going on other than the people that were there with you on the front lines. And even like the doctors, I feel like it was very difficult for them to see what we were going through because unlike, I'm not taking away from what the doctors do, their job is a very difficult one, but they were lucky, I guess you could say, in the sense that they really didn't go into patients' rooms at all, And so we were having to go into these rooms for hours at a time because we're trying to do something that we call clustering care, to basically like make the exposure less and also conserve PPE because at the time we didn't know if there was going to be enough personal protective equipment for us for how long. And so it was incredibly hard. And I mean, there was a situation where I was in a patient room for 4.5 hours. My patient was trying to crash and die on me the whole night, and I was just trying to keep him alive. And it was really hard because his daughter was a nurse, Um, I'm sorry. Um, and when this first started, I mean, we didn't have families going in, and just, I'm so sorry. Just being there, trying to get an iPad. I'm so sorry. An iPad to make sure that their daughter or son or whatever family member was there for them, maybe when they were passing away. And like, the thing is, sometimes it wasn't even, we didn't have that time to be like, it's happening now. Like, it would just happen so quickly. And during that time, like, I remember being in the room, and it was me and another nurse who was helping me try to stabilize him, and a respiratory therapist who was, you know, holding the iPad and making vent setting changes. And the doctor was standing outside the room looking through a screen glass, you know. And I mean, this might have just been that particular doctor, because there were some doctors that were excellent. They would go in anytime there was a problem, but I would say a lot of them were not entering rooms. And I think it was really hard for the nurses, because we were doing so many things that we usually wouldn't do. You know, housekeeping wasn't going into the rooms, so we were cleaning and picking up the trash. You know, phlebotomy wouldn't come to draw labs, which, you know, we would draw the labs, everything. Sometimes respiratory therapy wouldn't come into the room, so we would have to like change the vent settings with their instruction. So it kind of felt like in the beginning, like we were a little bit of a sacrificial lamb, because I don't know, like it just felt like the nurses are going to be there, so, you know, let them do everything. But you know what, like, I'm happy that it happened that way, because I was able to be there as much as I could for my patients. And I mean, I'm still struggling. um I think one of the hardest parts too, I was at a large teaching hospital in Boston, and I think one of the hardest parts was going into the rooms, and almost all the patients that we had in the ICU, a large majority of them, were either a Black or Hispanic population. And it kind of just brought to like your mind um, how lack of access to healthcare was causing a problem in these communities. Also, like, you know, the way that Hispanic communities live, you know, we don't live just alone. You know, it's most likely you live with your parents until you're married, and then your grandmother lives with you. So it would be really sad, because you would have these patients that the mom would like come in for COVID symptoms, and then 3 days later dad was in the ICU, and the children were also sick with COVID. And it's like, what happens if both of these parents don't make it? Like, who's going to take care of these kids, you know? um and I mean, I did whatever I could, because since I was the only like native Spanish, well, I think I was one of 2 or 3 nurses in all of the COVID ICUs that spoke any Spanish. So for me, like, even when I had like my own assigned patients to take care of in the ICUs, um, I would like write with a tape on my chest that would say like native Spanish speaker, so that, you know, I would be able to help like other nurses and patients, because a lot of times, like, let's say you were in the ICU for 2 weeks, you were heavily sedated. We would try come down on your sedation to see if maybe we could get the ventilator off. And to wake up in an ICU and have a nurse that doesn't speak your language, that you have no idea what's going on, is really scary. So even though I had my patients, I would go into the rooms and, tell them like, hola, me llamo Natalia, estás en el hospital, like, apriétame la mano, trying to do things that would make them feel calm, and then reassure them that, I was talking to their families, that they knew what was going on. And, just me being there sometimes when the breathing tube did come out, so that I could instruct them, like, take a deep breath. This is what you're going to do. Like, it was in some ways, like, I look back at this experience. I get so emotional. I'm so sorry. I look back at this experience and I'm so grateful that I was in Boston, because I feel like even though we had, patients pass, the ones that did come out, I feel like I was able to be there for them, because I would fight. I would be like, Maria, like, tose duro, like, you need to be strong so that we can get you out of this ICU. And I'm happy that I was there, because I wonder, like, what it would have been like if they didn't have someone that understood them, or understood like the complex family dynamics that come within being a Hispanic or Latino person. Like, a lot of these nurses, I feel like one of the most difficult things in nursing is being perceptive of other people's cultures and communities. And I think it can be really difficult sometimes to understand why Latino culture is so involved, and so, it's not just a nuclear family. It's your tío, your tía, your cousin that, is your second cousin removed, but you grew up together. It's something that they didn't understand. And so when we would set up FaceTime calls with the families, like, I would go into my patient's room, like, yeah, maybe it was an hour of my time and I was going to be behind on everything else that I had to do. But like, I would go there and I would like talk to the families. And I remember, like, I had this patient, I'll never forget him. He was originally from Mexico. And when on our documentation system, there's like a little picture on the upper left-hand corner that shows a picture of what you looked like when you were like admitted. And seeing that picture versus what I was looking at a month later was crazy. In his picture, he looked happy, healthy, full cheeks, and he was just emaciated. He had lost, 30, 40 pounds during his admission. He had pressure of like bed sore. And I remember, like, the first day I walked into that room, his like whole disposition changed. And every time I came to work, I would pray. I'd be like, please, I want him, I feel like I can make a difference, because he was depressed. And he would tell me, like, he couldn't verbally speak, but he had already been trached, so he could move his mouth and I could read his lips. It was very difficult. But he would tell me, like, I'm depressed, I don't want to be here. So also just like doing things to try and make him feel better. So like I would find out what his favorite songs were. So we would like go on YouTube and, you know, play his favorite mariachi bands. And I still think about him. I wonder if he got out. Um, they didn't think he was ever going to be able to come off the ventilator. And I mean, this is all, you know, I'm taking a step back from critical care after this. I have, you know, it was hard. And not only was this all happening, but I was doing it alone, you know, in Boston, sheltering in place on my days off, no social contact. I didn't want to go to the grocery stores because I was scared I was going to infect people. So, and, you know, my family was here in Miami. So, you know, only so many FaceTimes when the social isolation really got to me. And I think with everything, like, it got really bad. I I still have, like, I'm still suffering, and I I have a little bit of PTSD. Like, I have nightmares sometimes. Um, Also, like, sometimes I will hear like the ringing or beeping of certain alarms while I'm going to sleep or in the shower. I remember one night I got back home from a particularly challenging shift, and I got into my shower, and it was nice because, like, when you got home, usually in nursing, when you go home, there's like a way that after a couple of years you learn how to leave work at work, uh, especially working in the ICUs. And it got really hard because you would think about, well, you know, am I going to come back tomorrow? Are they going to be there? Like, what's going to happen? And so you would come home thinking about your patients. Not that it didn't happen regularly, but I think during this time it was necessary. And I remember getting home one night and getting in the shower, and as soon as I got into the shower, I just heard the beeping, the alarms, and like I just couldn't stop the sound from like hearing that sound. It was like a phantom experience, and like I can't really explain it, but I remember just breaking down and just asking God. I was like, please help me. Like, please take these sounds out of my head. Like, I just want to sleep. I just want to be okay again. Um, and it was hard. I mean, it was hard, and it, like, you felt like you were being supported by management, but at the same time, like, you know, the hospital was trying to save money. You know, in the beginning it just kind of felt like we were in the dark and just trying to figure out what to do as best as we could. But it was, I mean, it was really hard. I don't know what else to say. But I'm hopeful now. Now I'm back in Miami, and obviously the case numbers here are going up, and it concerns me. However, I think we have also had a couple of months to kind of figure out like what treatment modalities work, what was able to get people off the ventilator, certain complications that could arise, like strokes, that were very common in these COVID patients. So I think with more time, we're now getting a little bit more of a hold on how to treat it. So hopefully now with this second wave, or, you know, where Florida cases are surging, it will be a little better. But from what I hear from my previous coworkers is it's terrible. Like the hospitals are filling up, they don't have enough staff. The ratios for ICU are from usually 2 patients, sometimes 1 if they're very, very ill. And they're going up to 3 patients or 4 patients now. So it's just a crazy time and a crazy experience to be a nurse, to be on the front lines right now. And on top of it, like we were working more than our 36-hour shifts, you know, a lot of people were doing 48 because you just felt like you're like, okay, well, I'm at home here sitting sad, depressed by myself. Like I might as well go to work and help. But then it was like a double-edged sword because then you would go to work and have to deal with sadness, death, you know, this worry of whether or not there was going to be PPE, and if it was, you know, if it was adequate enough to like be using the same mask for 12 hours, in some cases a week. And it was just crazy. I don't know what to say. I could go on for hours on my experience in the COVID ICUs in Boston.
Thank you, Nati, for sharing. You can continue. You can continue as long as you'd like. I just want to acknowledge, like, thank you so much for sharing your experiences. I'm sure it was just such I can't even imagine. So I thank you so much for sharing your difficult experience, kind of being on the front lines.
Yeah, you're welcome. But I mean, it's really, what's really sad right now is seeing, after all the work all these frontline workers put to like make the numbers go down, make everything, you know, better, that now people are complaining about like not wanting to wear a mask. It's a slap in the face, you know? It's a slap in the face because I had nurses that had asthma, had CHF, you know, we had employees that we had to wear a mask our whole shift. And on top of it, we had to wear a mask that was an N95, which is a lot thicker and actually filters out like air, while the surgical mask does not. And to hear people like complain of them not being able to breathe, or them saying that they have this condition that doesn't allow them to have a mask, it's just frustrating because it's like there are so many people that are putting their life at risk every single day to help others. And you can't be bothered to put a mask on for 20 minutes while you go inside a store. It just bothers me so much. And like seeing the governor of Florida or something just not acknowledge the seriousness of this disease. I'm not saying that the economy shouldn't have reopened. Like I understand that, but there's a way to do it. And unfortunately, I don't think that the average person can be trusted enough to actually do something that's going to benefit others, because people are, I don't know, maybe I've become jaded because of nursing, but I think people are selfish, and it makes me sad because I went into this profession because I wanted to give to others. And I just don't have that in me. So I think it's been really hard for a lot of healthcare workers. And I'm not going to speak for all of them, but personally how I feel to have people complain about having to wear a mask inside, or like while they're walking, or, you know, it's just crazy because we wore a mask for 12, 13, 14 hours, some of the doctors 24 hours when they would do their shifts. and we would do labor work, like turning patients. Some of these patients were 300, 400 pounds. You know, we would have to turn them, bathe them. You know, it's labor. You know, it's not just giving medications. And you know, the ICU is somewhere that it takes a lot of work, and it's backbreaking. And so if we could be in those rooms doing that backbreaking work in a hard N95 mask that's thick, it feels like cardboard or like plastic, then people can wear a mask for 30 minutes to help others, you know, because the mask, it doesn't protect me from you, it protects you from me. So sorry about my rant about masks, but that's just how I feel.
Well, did you notice now that you know, went from Boston to Miami, did you notice any differences kind of with like the people and reactions and just the overall environment?
Yeah. So I think in Boston, people took COVID very seriously. Um, I mean, you wouldn't see anyone, like, people weren't hanging out with anyone other than their nuclear family. Like, if you were seeing someone, it would be on a walk outside and you would wear a mask the whole entire time. And I don't know if it's because time has passed and people have gotten like stir crazy from being indoors. It's just, I just feel like here it's gotten a complete different reaction of people just being like, well, you know, if I'm gonna get sick, I'm gonna get sick, you know. And it's like, that's not the point, you know. Like, and also it's not guaranteed that you're not going to end up in the hospital. Like, sure, there are conditions that will predispose you to, you know, potentially being hospitalized more than another person, but the truth of the matter is, you don't know. I had patients that were young, 24, 29, 30s, you know, like, who had never had a pre-existing, and they were in the hospital in the ICUs. So and with 4th of July just happening, it was disappointing to see people in Miami out on their boats, not taking things seriously. And it's just, I feel like every healthcare provider I know has become a Facebook keyboard warrior, because we're just trying to have people take this seriously. Like, I've been in Miami and I've barely seen my family, and when I have, it's with a mask, because I'm like, I don't know if maybe I picked it up at the store, or, you know, did something, or, you know, maybe they picked it up. Like, we have to keep each other safe. Like, it it's it's I feel like it's the human thing to do, is to care for others, and like, care. Just because I don't have the potential of maybe ending up in the ICU doesn't mean that I shouldn't do everything in my power to make sure that someone else doesn't end up in the ICU. If there's one life that I'm able to save by wearing a mask, then I'm going to do it. And it's incredibly frustrating seeing, you know, people not taking it seriously anymore. I feel like people just kind of don't want to think about it anymore. They're just over it, you know. So
I guess on a follow-up to that, you know, and you kind of talked about it a little bit, kind of bringing up the Florida's governor, but what do you think about how this administration has handled the concerns of healthcare professionals during the pandemic?
I think this administration has failed us. Um, from the very beginning, you know, it was, you know, we have it under control, everything's fine, that's the Chinese virus, it's not going to come here. And they knew, like, the fact that the CDC pandemic team got cut because Trump didn't want to fund that anymore, the fact that Trump does not wear a mask, or like, even the fact that, like the things that he would say during his press releases, and people would listen, you know, like the whole disinfectant in your, like maybe we could put some disinfectant in your body. Like the day after, like New York Poison Control got calls of people like, you know, ingesting bleach. It's like, and I feel like the president and his administration is in denial of what's going on, and they just want to seem like they've got everything under control. But anyone in the healthcare world will tell you it's not in control. And there's so much. What we needed right now was a leader. And I do not think we got that in this administration. Donald Trump was not a leader of the people. He was a leader for himself and his administration. And yeah, I I think it's failed us. And I think that this pandemic, I mean, the one thing that I take away from this is that there is maybe a silver lining. And I hope that that silver lining was seeing disparities in healthcare, seeing the amount of Hispanic, Latino, and Black population that was hospitalized with this, how many of them were affected. Um, it was a major public health crisis, you know, bringing to light, you know, unemployment, people that were essential workers, you know, all this stuff. Like, I think if it wasn't for the pandemic, there wouldn't have been such a strong move for social justice and, you know, um, a movement to make this country better. Um, and I'm hoping that those things do come from this. I think it's been eye-opening for some people, and I think in some ways people are listening more. Um, but I don't think the current administration is listening.
You talked about the health disparities that have now become more apparent. They existed, but now have become more apparent. Can you speak more to that? Thinking about, and you talked about it in your experience seeing mainly a lot of Black and Latinx people in the hospital, but can you speak more to just that health disparity, why it exists, and any additional stories that you can recall from your time in the hospital?
Yeah. So I think that the health disparity exists is, unfortunately, like the United States is a country where access to healthcare is tied with your employer. And a lot of you know, employers that, you know, if it wasn't for Obamacare, it the rule of needing to provide healthcare if you had a company of more than 50 people was something that, you know, I feel like helped a lot of people. But I also think that because um, because healthcare is so closely tied to employment, um, people who are maybe struggling financially, unemployed, or maybe do like contract work because, you know, they are waiting for their citizenship or their residency card. So they're, you know, working in construction or something that doesn't have healthcare benefits. And I think a lot of the jobs, unfortunately, that don't provide healthcare are held by the Latinx and Black community. And I think because of that, you know, people aren't able to go to their preventative care, you know, and if there are free clinics, like the clinics don't have the funding to actually give medication. So like, for example, if you're diabetic, insulin is a ridiculous cost. like medications are unaffordable to a lot of people that don't have health insurance. So if it's the decision of, okay, like I went to the doctor because I went to the clinic and I found out I had diabetes, and whether it's my family eats or I pay for this medication to control my blood sugar, which do you think people are going to choose? They're going to choose providing for their family, you know? And I think it's sad that healthcare has gotten to a point where people have to make those decisions. I I think healthcare is a human right. Like I do not think who you are should, or where you stand financially should impact your access to healthcare. If we were to if we were able to provide good preventative healthcare, good medications that weren't, you know, ridiculously expensive, I think that, you know, our Latinx and Black community would be better. And also, you know, education's a big thing, you know, like teaching people, you know, them knowing about what a healthy diet is, like making food affordable, because, you know, yes, everyone knows that vegetables and lean meats and all these things and fruits are healthy for you, but what is what is cheaper? If I'm living a low, if I'm working a minimum wage job, am I going to go for, you know, rice and pasta that I can buy in bulk, that's relatively inexpensive, or am I going to buy, you know, fruits and vegetables to maintain a healthy diet? It's multifaceted. It comes down to education. It comes down to access to healthcare and healthcare benefits, cost of medications. Those are all really important things that need to be addressed, because these disparities in healthcare should should not be present. Everyone should have the basic right of being able to treat whatever disease they have or prevent them. You know, even going to a doctor once a year that's able to do labs on you and a full exam, that makes a difference, because even if you have your labs, your doctor could say, hey, your cholesterol's a little high. Let me teach you about cholesterol. Like, these are the foods. So I think that there needs to be a push to, you know, increase access to healthcare. And I think, I'm not saying that Obamacare is perfect, but he was going in the right direction of making healthcare affordable for people. Um, and, you know, I think COVID has made it apparent that it exists. I think once, you know, more time goes by, that there will be research that substantiates that people who have less access to healthcare were actually more impacted by this disease, or people that, you know, had lower socioeconomic status or education also were more impacted by this disease. Um, I mean, of course, there was the outliers. There were, you know, white people, you know, people who had access to healthcare that were still hospitalized, of course. But I feel like when we look at it in retrospect in a couple of years, there's going to be a pattern of people who were exposed or critically ill being either, you know, being unemployed, having no access to healthcare, lack of education, maybe, um, and all these things contribute to what we saw firsthand.
Thank you for sharing. So would you say that, and I think you talked about this a little bit, but has COVID affected how you feel about your career choice?
Um, yes and no. I love nursing. I can't imagine having done anything else with my life. I truly think, for the most part, it is a calling. Um, and I I am glad that and proud to be a nurse. And it I think it took COVID um, to make me realize that nurses are the backbone of healthcare. You know, I think for me, because I grew up in a certain, upbringing, being a doctor was, the best thing. And for me, like, I carried a chip constantly on my shoulder, like trying to prove myself that I could have been a doctor and I could have done these things. And I worked myself to the bone in nursing school to graduate first in my class. And it was like, for what? Like, at the end of the day, like, the person that needs to be proud of what they're doing is me. And because of COVID, in a sense, I have never been more proud to be a nurse. I have never been more proud to be surrounded by people that, regardless of being scared, regardless of not knowing what we were going to face that day, were there and willing to do whatever they could do to help someone. And I think that's beautiful. um, but I mean, being in the ICU 100% has made me want to just take a step back from critical care during COVID, just because, not because I don't love the ICU. Um, I love it. It's challenging. There's so much learning. Um, but I just needed to take a step back for my mental health. Um, and that's what it came down to. And I think, I mean, would I tell someone that I met off the street today to be a nurse with how things are going? Maybe not. Probably not, honestly, because I feel like hospitals are slowly becoming more profit driven. They see you as just a number, so you're replaceable, and you don't feel like you're there, you're important to them, and that the work that you're doing is important to them, because you take pride in your work. You're happy that you're there and you're helping someone. But when you don't get that same feeling of appreciation from your employer, um, it's disheartening, And I mean, I think a lot of people are going to leave nursing after this, because it was it was a battle between nurses versus administration. It would be easy for the administration to say, hey, you're going to have to use the same mask for 2 weeks, when they're not the ones caring for the patients firsthand. They're not the ones putting their life at risk. So I think if someone asked me right now, would you tell anyone to be a nurse? I would say probably not, just because things are changing so much. Um, it's the one thing that I loved about COVID, and this I will say, is nursing. The back of it, the backbone of it is caring for someone else, um, and being able to do, like, care routines and all this stuff, and being the best nurse you can be. And I think now, maybe prior to COVID, nursing had become so it had become so, documentation based. So, like, you were making sure everything was documented, that you put in your hourly intakes and outputs, that you documented your vital signs every hour. If you made a titration to a medication, that your vitals were reflective of that, that you wrote every note you could to cover yourself, in case, the hospital or the physician or you were ever to be, sued. It's become, and it's taken away from what nursing actually is, which is caring for the patient. And the one thing that COVID did was because we were in a crisis mode. A lot of these documentations, like documenting activities of daily living, documenting the plan of care, the education, all these things were kind of put in the back burner. We didn't like because we were in crisis. So in that sense, like we really got to focus on what nursing was, um, which was to be there for the patient and to be a nurse, you know. And I think that was that was the one beautiful thing, not the one, but one of the most beautiful things about this pandemic is that it made me realize that if nursing was to ever be this way again, I would choose it in a heartbeat, no questions asked. But I think that the way that healthcare is moving, um, I don't know if it'll be the same in 10 years, 15 years, 20 years, you know?
Well, thank you for sharing that. And I want to be respectful of your time. So I'll kind of just end with, is there anything else that you'd like to share with me about your experiences with COVID that I've not asked about yet?
Um, no, I think we covered most of it. I mean, obviously there's always more that, you know, we could talk about, but no, I think that was pretty good coverage.
Okay. Well, if you wanted to share anything else, I know you shared multiple stories of the hospital but if anything else that you'd like to share, you can share it now. I don't want to cut you off in any way. I just want to be respectful of your time.
No, thank you. I appreciate it.
Well, thank you, Nati. I really appreciate it. Were you going to say something else?
No,
Zoom is so weird. It's always so awkward. But thank you, Nati, so much for sharing your experiences um, and everything, especially as somebody that has been on the front line. And you know, I don't speak for everyone, but I speak for myself, and I'm very thankful.
thank you.